Hello, welcome along to this month's topic, which is incontinence and bladder problems. And today I'm talking to Claire Doherty. Claire, would you like to introduce yourself?
Hello everyone, thank you for giving me the opportunity to speak, Emily. My name's Claire Doherty, as Emily has just said, and I am a medical intuitive. I also hold qualifications in nutritional therapy and physiotherapy. So I'm going to chat to you today a little bit about my understanding of bladder problems and how going into this period in our lifetime can be a little bit of a surprise for some of us when we start to develop problems with the bladder that we've maybe not had before.
Absolutely. And I think a good starting point is a lot of women kind of think that if they've had children, it's a given that they might have some bladder problems. And obviously we see all the adverts on the telly for Tenor Lady and whatever, which assumes that this is something we must all just put up with. But that's not the case, is it?
No. And I mean, it's like any symptom that we might experience during the perimenopause, going into the menopause. It's not everyone that will experience this. So we can't say, nobody's going to get it. We can't say, yes, we're all going to get it. It's just like any other symptom. And it varies really depending on a few factors. But one of those is, again, estrogen. So we do know that estrogen affects the way that the bladder and the urethra function. So when you get differences in estrogen, which we do when we are perimenopausal, we get these fluctuations of estrogen, and it's the kind of the falling estrogen that affects the way that the bladder functions and the urethra. So our normal capacity to hold urine reduces. So there's different types of incontinence as well. We can have urgency incontinence, where we suddenly have a real urge to go to the toilet, and we can't hold that urge, and so we need to go as soon as we get that sensation, we go. Whereas normally we might have had that sensation like, oh, I need to go to the loo and empty my bladder, and you can hold on to that until you get to the toilet, and that can reduce, and that can be quite distressing, because obviously if you're out and about and you suddenly get the urge to go to the toilet and you're not near a toilet, you can end up being incontinent. And the other type of incontinence we get is stress incontinence, which tends to be slightly different. You don't have that urgency, but it can be more of a kind of a leaking type issue, particularly with movement. So it might be if you're doing exercise, or if you sneeze or laugh, or walking, anything that might put a little bit of pressure on the pelvic floor. And along with the changes to the bladder and the urethra that we get, we also can get changes to the pelvic floor as well, because we get changes in muscle tone when we're going through the perimenopause and the menopause, which is why exercising and core stability is really, really helpful for bladder problems, because if we can support the perineum, then we can help to support the bladder really, and urinary function. As a physio, when I worked in women's health, this is one of the techniques that we use quite a lot with ladies going through this period of their lives that were experiencing problems. So whilst we can't always do much about the estrogen component, I'll come back to that in a second. We can try and kind of strengthen the muscles that are supporting the bladder. So pelvic floor exercises and core stability, really good for that. Kegels exercises. So if you are suffering with incontinence, don't just kind of write it off as something that you've got to put up with. Go and see your women's health physio, or go and see your GP and see if you can be referred, because there are things that can be done to help you. And then going back to the estrogen, falling estrogen, well, of course, if you decide to go down the HRT route and try HRT or maybe bioidentical hormones, then there is some suggestion that that can help your bladder function as well, and maybe help incontinence if you're experiencing that, because obviously you're trying to sort of normalize and balance out that estrogen again. So that's the kind of more conventional view of bladder problems and what we can do to help. And then kind of from the metaphysical point of view, you know, sometimes we can experience different problems with our bladder. So not just incontinence, but cystitis can be something as well that perimenopausal women get, and UTIs. And so the theory with the experiencing things like this is that we are being invited to ask ourselves where we're feeling kind of pissed off, where we're feeling annoyed, irritated in our lives, and we're wanting to get rid of something, because the bladder is all about removing waste from the body, detoxification, and really kind of like, you know, getting rid of all the things that are going to be harmful for us if we keep them in the body. So if you're getting repeated UTIs or bladder problems, it's maybe a good idea to kind of ask yourself, am I feeling annoyed with something in my life? What's really irritating me that I don't want to be in my life anymore? Incontinence is slightly different, because incontinence is that kind of, it can be twofold things. So one, it can be an inability to sort of hold on, where you're so desperate to get rid of something that you're not holding on anymore. So again, a similar thing. But it can also be connected on a metaphysical level to kind of, how to phrase it, a desperate need to kind of like, to void, to have like space, and to let things fall away. So again, you know, we're just being invited at this time in our life to explore that. And for some of us, it might be the need to get rid of this whole thing that we're going through, because we might feel so uncomfortable with it and so annoyed with our bodies and so annoyed with the whole concept that we're not, you know, we're not relaxing into it. And that can be quite a hard thing to do, to relax into something that's making you feel really uncomfortable. But it's worth exploring it and finding why we're feeling like that. And maybe there's a way to make things easier for you. Maybe you can get a little bit more support from somebody. Maybe there's some changes that you can make that are going to make this whole process a little bit easier for you, so that you're not feeling really annoyed, and that you're not feeling, you know, really hacked off with everything.
Yeah, it's interesting, isn't it, how all the physical symptoms always have a sort of a story behind them, and we've become so quick to go to the doctor and take the thing that treats the symptom, that we've got out of the habit of looking for why it's happening. And actually, that, you know, I think looking into these things and using this stage as a chance to address all the things that we've not been happy about is so important.
Yeah, absolutely. Yeah, 100%. I mean, it's so easy to just kind of blame this on a physiological change, which it is. There is a physiological change, but it's not as easy as saying it's just because we've got changes in estrogen. Because as I said right at the beginning, if it were, we'd all have the same symptoms all of the time. So it's always an invitation to kind of look at what else is going on in our lives, and to really kind of find out what we can do to support ourselves a little bit more, rather than just going, well, it's because I'm perimenopausal, so I'm going to have to live with this. That's not really what's happening. This is an invitation to explore ourselves a little bit more, and maybe take a little bit more care of ourselves.
And even for people who don't want to go down that route, they still don't need to put up with this, because there's all the women's physio stuff that they can do.
Exactly.
And this perception that, you know, laugh and leak thing, that's it doesn't have to happen.
No, it doesn't. And, you know, you can really radically improve your symptoms. You know, you have to do pelvic floor exercises several times a day. You know, it's quite intense, but, and you're taught techniques to try and sort of, you know, reduce the urgency and, you know, as well as the stress incontinence, but they really work. So the longer you leave it, when you start to have symptoms, the more work you have to do to try and get that strength back up. So if you can go and get help as soon as you start to get those first symptoms, it's much easier for you then to get on top of it and to strengthen everything.
And this is I think really important to stress, is that a lot of us don't realise that women's health physios exist out there. We all think of physios dealing with spines and hips and stuff.
Exactly.
And actually, your doctor can signpost you to a women's health physio just as much as to a whole body physio.
Absolutely.
And they are worth their weight in gold.
Yeah, absolutely. Yeah. Your GP can refer you. They're normally within a hospital, so within an outpatient department. Not every hospital has one, but you know, you do have access to one through the patient's charter. So even if your GP says, well, I don't know where to refer you, if you can find a physio by, you know, doing your own research and go back to your GP and say, well, there's one here, then, you know, hopefully you'll get referred. I mean, there are private ones as well, but you know, there's plenty on the NHS.
And the same in other countries. You know, the point is that the women's health physio is the person who can help you in the first instance.
Absolutely. Yeah, they're everywhere. So, and I think actually, I'm not sure actually, but I think in some other countries, other health practitioners do this sort of thing as well. So I think some private midwives, maybe, you know, in countries like America, are trained in things like this. I'm not sure, but there are definitely women's health practitioners, whether that's a physio or, you know, whoever else, that would specialize in this kind of thing, that would be able to definitely help. Yeah.
Brilliant. Thank you so much, Claire.